Aquí invadiendo. Uy, ¿qué me
Caminando por la calle yo te vi, caminando por la calle yo te vi, ya un día yo me enamoré de ti, ya un día yo me enamoré de ti. Caminando por la calle yo te vi, caminando por la calle yo te vi, ya un día yo me enamoré de ti, ya un día yo me enamoré de ti.
Houston Shoulder to Shoulder Foundation provides health services for the underserved people of Honduras and promotes self-sufficiency at a grassroots level. Since its inception, Houston Shoulder to Shoulder has focused its efforts in Santa Ana, Honduras. Santa Ana is located in the mountains of western Honduras, bordering El Salvador. Although the village has only about 700 inhabitants, Houston Shoulder to Shoulder serves 15,000 people from some 18 villages that are within walking distance of the clinic. The closest hospitals are 1.5 hours away in El Salvador and 5 hours away in La Esperanza, Honduras. In May 2004, construction of a clinic in Santa Ana began at the request of the local government. The clinic provides primary care services for patients of all ages from Santa Ana and surrounding villages. Common problems encountered include headache, dehydration, parasites, gastritis, and malnutrition. Patients can also receive optometry and dental services at the clinic. Twice a year, a brigade of medical faculty, medical students, optometrists, public health students, and a dentist travel to Santa Ana to conduct large clinics. General medical services, well-woman exams, optometry services, and dental services are provided.
The thing that's truly unique about Houston Shoulder to Shoulder Foundation, and I think the thing that we have to offer that's the best, is an ongoing relationship with a group of truly resource-poor rural folks in Honduras and El Salvador to really work with them on an ongoing basis. The clinic is going to be awesome. It's going to provide truly state-of-the-art medical care, dental care, eye care for the folks in this area, and we're talking some perhaps 15,000 people in 18 different villages. Once we get the clinic completed, we hope to be able to embellish our services in terms of laboratory, ultrasound, x-ray, and ultimately we would like to have a surgical center where we can do cesarean sections.
What I think is really unique about Shoulder to Shoulder compared to other medical service trips that I've gone on is that at Shoulder to Shoulder, when we're able to do things like pap smears and biopsies, because Carol Gomez is there and she's able to follow up on the results.
It's going to be huge to have the dental clinic completed and to have a full-time dentist there. As you know, we already have a full-time physician, Carol Gomez, who's done some 20 years of work in rural areas like Santa Ana.
Estoy trabajando para la clínica comunitaria de hombro a hombro. Soy la única persona contratada para atención del paciente en el área de la salud, lo que significa que mis acciones son múltiples. Soy enfermera, registradora, consejera, farmacéutica. Toda la atención que se le brinda al paciente está bajo mi responsabilidad.
The pharmacy is stocked by donations from American physicians, hospitals, and drug companies, and is staffed by medical students or village volunteers who fill the prescriptions and explain the medications to the patients. Working in the clinic and the pharmacy provides tremendous learning opportunities.
We try to improve health mainly through public health sort of endeavors, through improving water resources, sanitation, nutrition programs to try to vent smoke from the house, to improve the level of hygiene within the household by building floors, things like this that you've participated in.
Caminando por la calle yo
As a fourth-year medical student, having just returned from the shoulder-to-shoulder trip, I really feel much more confident about starting residency, and seeing the large volume of patients I know I'm going to be presented with as a resident and as an intern.
Our public health project basically involved working with the village community members and teaching them how to teach. So basically we would use plays, models, and posters and teach them how to make them as efficient as possible to reach the community at large.
As great as this experience is for medical students, the villagers of Santa Ana have also benefited and played a large role in the success of the clinic.
Nos reunimos para hacer gestiones juntamente con la comunidad. Aquí tenemos un trabajo pues invertido pues de la mano de obra.
Yo he sido una de las beneficiadas que cuando mi hijo se me enferma lo he traído acá a consulta, ya no me tuve que viajar a El Salvador.
With these brigades, the Foundation strives to provide students and faculty from Baylor College of Medicine and other institutions, as well as interested community members, experience working in resource-poor settings to foster interest in global health.
me enamoré. Caminando por la calle yo te vi. Caminando por la calle yo te vi.
It's always great to just get a variety and to have the opportunity to work with other cultures.
Ya un día yo me enamoré.
They invite you into their village. They treat you like a member of the community, which is quite an honor.
Hubiera clínica y vinieran los médicos, pues sería muy difícil porque aquí cerca no hay doctores, no hay clínica que den consultas y haya médicos disponibles para atender a los pacientes.
The Houston Shoulder-to-Shoulder program really sparked my interest in primary care. It gave me the inspiration that I needed for the rest of my career in medicine.
To really get to work with local people, shoulder to shoulder, to try to improve their health care.
No, 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 no.